Nursing and the Listening Process, Elderly Care. This presentation is about the listening process and why it is important in relation to the elderly as a nurse. Listening is an important aspect of everyday communication. It is important to hear what the speaker is trying to tell you, listen to the important information in the conversation, understand what the speaker is trying to say, respond to the speaker, and remember the important aspects of the conversation. This is known as the listening process. In addition to the listening process, there are 3 elements of effective communication: acknowledgement, participation, and engagement. The elderly are sometimes left out of conversations, even when the information pertains to them. Many problems can arise due to age-related issues, such as hearing impairment, a decline in vision and memory, and the inability to read and understand. The first part of the listening process is hearing. Hearing is the physiological dimension of listening. Sound waves strike the ear at different frequencies and loudness. It is important for the nurse to hear the elderly resident, so the environment should be noise-free. It is also important for the resident to hear the nurse, so the nurse should speak at an appropriate level, and the resident should have their hearing aids in if they need them. The elderly have a hard time hearing due to illness and less energy. The second part of the listening process is attending. Attending is the psychological process of selection. People express tiny details in everyday conversations, especially the elderly. If the elderly is asking for a pain pill, she may continue on to tell you that she went to Bay Area Medical Center in December of 2006 to have hip surgery, and that her aunt went there 2 years prior to also have hip surgery, and then she may continue on to tell you more about her family. But it is important to remember only the information pertaining to the pain pill in order to help her effectively. You need to set aside less important details unless they are relevant. The third part of the listening process is understanding. Understanding occurs when we make sense of a message. It is possible to hear and attend to a message without understanding it. It is important to understand in order to help. If a resident says she doesn't feel good, and you give her medication for a stomach ache, you may not give her the adequate medical attention that she needs, and more serious consequences could result. It is important that they understand you as well. If a resident doesn't feel good, you need to understand exactly why in order to help them. The fourth part of the listening process is responding. Responding is giving observable feedback to a speaker. Any questions that a resident asks need a response, as well as statements. A good nurse responds to any message and gets back to the resident if she doesn't know the answer. Body language, tone of voice, word choice, and speaking tone, or speaking voice, are all aspects that a resident may look at to determine how you feel about their conversation they're having with you. The nurse needs to be interested and polite. Acknowledgement. Acknowledgement is to take notice of or reply to. The elderly are not acknowledged, they are overlooked, avoided, and often talked down to. Nurses need to do the opposite. They need to acknowledge the resident, they cannot overlook their conversations, they cannot avoid them, and they should not talk down to them. They need to ask residents questions that pertain to them instead of asking their family members. Asking their family members is only going to upset the resident because they are going to assume that you think that they don't know what they want and need. Abuse is one thing that is often ignored. For every 1 reported case of elder abuse, 5 cases go unreported. It is important for the nurse to listen to the resident, especially in cases of abuse, because it needs to be passed on to management so that it can be taken care of. The final part of the listening process is remembering. Remembering is the ability to recall information. This is one of the most important parts of the listening process for nurses. The elderly ask for several medications at one time while also telling you a story. It is important for you to remember exactly what they asked for so that you do not forget what they want. Participate. Participate is to have a part in or share in something. Nurses need to allow the elderly to participate in their care. Nurses should talk to them, ask their opinion, and ask their preferences. Engage. Engage is to interest and involve. Nurses should disclose any medical information that the resident asks for and that they are allowed to give out. Any way to involve a resident in their own care should be followed through. The importance of listening and remembering. One of the importances of listening and remembering is person-centered care. Person-centered care is knowing about your residents and their life, likes, dislikes, and hobbies. Listening and remembering make for a better care and fluid conversation. Also, the elderly are going to be more comfortable and trusting if you remember things that they tell you. It is also important in understanding their freedom of choice, values, preferences, and needs. Whether to crush their pills or keep them whole, and whether or not they take a certain medication or not, is very vital in remembering what they want. You need to treat others as you would want to be treated, and put yourself in the resident's shoes. And you need to communicate your feelings with them so that they know exactly how you are feeling at all times, and so they don't take what you say the wrong way.